Hello, my name is Kimira Kholwane and I'm with my colleague K Tata Hatsisi and today we are doing a presentation on human geography. Now this presentation will be based on the impact of COVID-19 on the mortality rate of our respective communities that we are from. So, first, let me define the mortality rate. Mortality rate is the measure of the frequency of the occurrence of deaths in a defined population during a specified period of time. It is typically expressed per 1,000 individuals. So, it's not the overall, but per 1,000 individuals. Now, we are going to be focusing on the impact of the COVID-19 during 2019 and 2020 because this is when COVID-19 affected South Africa the most. Now, since December of 2019, the COVID-19 pandemic has caused a varying but devastating levels of mortality in South Africa. Now, South Africa is one of the countries that experienced the fatal effects of COVID-19. Can you believe it? Okay, South Africa faced its first COVID-19 casualty in March of 2020. Ever since, the country has registered over 85,000 civilians who lost their lives due to COVID-19. Now that's significant. That's a lot. Now, throughout the outbreak, the largest daily death recorded was on January the 19th of 2021. Now, I know that I said we'll be focusing on 2019 and 2020, but the largest deaths per day were recorded on 2021, January the 19th. Some would wonder why, because South Africa was hit by COVID-19 the most in 2020 specifically. Now, as of October 24th in 2021, South Africa was the most affected country in the continent, not even in the southern hemisphere. In the continent, the whole of Africa, South Africa was the most affected country in the whole of Africa, with over 2.1 million cases recorded of infections of COVID-19, of course. Now that's a lot. It would mean that the mortality rate obviously increased in South Africa. Now, the most deaths occurred in Western Cape with 65.5%, followed by Eastern Cape with 16.8%, and Gauteng with 11.3%. Now, Tato here is going to talk about the impact of the COVID-19 in the mortality rate of Free State, because that is where she is from.
Greetings. As introduced, my name is Tato Hatsisi. I'll be talking about the impact of COVID-19 on the mortality rate of the Free State province. On the 31st of March 2020, Free State first reported its first death, which was Mr. Hlangeni John. The total number of deaths caused by COVID-19 in the Free State province by the year 2022 was 7,321. In 4 waves that occurred, 304 cases of deaths were reported in the first wave, and in the second wave, 388 cases were reported, and in the third wave, 411 cases were reported, and on the fourth wave, 208 cases were reported, which shows a major decrease in the number of deaths compared to the first up to the third wave. Healthcare service provision was also a contribution to the COVID-19 death rate, or rather the mortality rate. This is because COVID-19 had placed a lot of pressure on the healthcare service system, because there were lack of nurses and doctors in our clinics. This therefore meant that there were no people who were gonna serve all the people who were coming to the clinics with COVID-19 cases, and the clinics faced overcrowding, and there were shortage of medicine sometimes when people came. This therefore led to a rapid increase in the mortality rate of deaths due to healthcare within the province. 27% of clinics in Free State are in a bad state. This therefore means that when you get to the clinics, there is inadequate space, or rather very limited space for people to maintain social distances, which itself posed as a risk to people who came to the clinic. Even those who didn't have COVID-19 were at risk of getting COVID-19 because there were no space that is enough to social distance and prevent them from getting sick, or rather infected from the
So
contagious.
there was a direct contact of people
Exactly.
in the clinics, even though others didn't have COVID-19.
Yeah.
They would have had COVID-19 when they went to the clinics.
Yeah.
Oh,
Exactly.
wow, that's interesting. Now, Gauteng recorded the highest number of infections in South Africa. I'm from Gauteng. Gauteng contributes to 26% of South Africa's population. And in Gauteng, there's the city of Joburg, which is also where I'm from. The city of Joburg in Gauteng is among the top 10 most dense populated cities globally. Now it means that Joburg has a lot of people. Soweto is in Joburg. It is the largest township in South Africa. I'm from Soweto, in Joburg, in Gauteng. There was a study in Soweto that investigated if the perception and attitude of people in Soweto would influence the COVID-19 uptake. Now, this study showed that people in Soweto, because of the high population in Soweto, really did take COVID-19 seriously. They didn't go out more often. They took the precautions and regulations seriously. And when the vaccination became available, they took it as they were advised to, because they are very populated. They are densely populated. Vaccination stations were made all around Soweto so that people can have access to vaccine, and they don't have to go long distances to the clinic to get the vaccine. Now, the vaccination was more available to the older and young people, as they were encouraged, because they are the ones that are most they are the ones that were most affected by COVID-19. Now, even though there were resources, facilities, and vaccinations available to the people of Soweto, the mortality rate in Soweto increased from 3.4 in 2019 to 4.9 in 2021, which is a 44% increase. Now, the greatest increase were in the 65 plus years and the children under the age of 5 years. Those were the people who were infected by COVID, and they died of COVID the mostly during the COVID-19 era.
Free State had shortage of resources, and the health facilities were in bad shape. That is why the mortality rate increased rapidly. And in Soweto, resources were available, vaccinations were available, and all the resources that were needed were available to them, but the mortality rate still increased rapidly. This was because Soweto is a very populated area. This therefore meant that they couldn't reduce contact of people, therefore increased the rate of mortality in Soweto.
Now, this, in conclusion, proves that different factors affected different provinces during the COVID-19 era. And that is how the mortality rate in South Africa increased as a whole.
Thank you for watching.
Thank you.